Occupational Safety and Health Standards, or OSHA. By the end of this lesson, caregivers will be able to know how to prevent work-related injury, occupation exposure to bloodborne and TB, disease progress of TB, HIV, Hep B, and Hep C, universal precaution, responsibilities and reporting mechanism for exposure incident. First, let us talk about what is tuberculosis or TB. Tuberculosis, or TB, is a disease caused by bacteria called Mycobacterium tuberculosis. TB spread from person to person through the air. Not everyone infected with TB bacteria becomes sick. As a result, two TB-related conditions exist: latent TB infection and TB disease. All U.S. healthcare personnel should be screened for TB upon hire and annually. What are the differences between latent TB infection and TB disease? A person with latent TB infection usually has a TB skin test or blood test result indicating TB infection, has a normal chest X-ray and a negative sputum test, has TB bacteria in the body that are alive but inactive. A person with TB disease also usually has a TB skin test or blood test result indicating TB infection. He or she may have an abnormal chest X-ray or positive sputum smear or culture and has active TB bacteria in the body. A person with latent TB infection does not feel sick. He or she cannot spread TB bacteria to others and needs treatment for latent TB infection to prevent TB disease. A person with TB disease usually feels sick and may have symptoms such as coughing, fever, and weight loss. He or she may spread TB bacterial to others and needs treatment for TB disease. Risk factors and symptoms of tuberculosis. Some people develop TB disease soon after becoming infected, within weeks, before their immune system can fight the TB bacteria. Other people may get sick years later, when their immune system becomes weak for another reason. Symptoms for TB disease include any of the following: a cough lasting longer than 3 weeks, unexplained weight loss, night sweats or a fever, loss of appetite. Generally, persons at high risk for developing TB disease fall into two categories: persons who have been recently infected with TB bacteria, persons with medical conditions that weaken the immune system. When TB bacteria become active, multiplying in the body, and the immune system can't stop the bacteria from growing, this is called TB disease. TB disease will make a person very sick. People with TB disease may spread the bacteria to people with whom they spend many hours. It is very important that people who have TB disease are treated, finish the medicine, and take the drugs exactly as prescribed. The first-line anti-TB agents that form the core of treatment regimens are isoniazid, INH, rifampin, RIF, ethambutol, EMB, pyrazinamide, PZA. Next, we are going to talk about how to prevent work-related injuries. When doing house cleaning and housework, caregivers should use good body mechanics. Don't twist your body, but use your feet. Bend your knees, not your back. When lifting heavy objects, keep them close to your body. This can reduce back pressure. If it is too heavy to bear the pressure, ask for help. If you move the furniture to clean the floor, please push, not pull. If it is difficult to move, ask for help. Put casters on heavy furniture feet for easy movement. Good physical mechanics: beware of back and shoulder injuries and body aches. Use the following tools to make the task safer: long-handled dust collector, mop, ladder tool. Use clean gloves to protect your skin when you clean. When you do laundry for customers, you must pay attention. Beware of contact with clothing contaminated with infectious body fluids. Use good physical mechanics to handle and load clothes to prevent injuries. Use safe and good physical mechanics to transfer customers to avoid injury. Be careful not to come into contact with infected blood and body fluids. There are no cure for bloodborne diseases, such as HIV, hepatitis B, and hepatitis C. If you encounter the following events: the skin is pierced by a needle or sharp object stained with blood. Maybe you may encounter injection needles, diabetic sticks, discarded needles, razors, or a piece of broken glass when cleaning up the garbage. The infected blood splashed into the eyes. Touch the infected blood when the skin with open wounds. You may be at risk of contracting HIV/AIDS, hepatitis, and other bloodborne diseases. Bloodborne pathogens can be transmitted when blood or body fluid from an infected person enters another person's body via needle sticks, human bites, cuts, abrasions, or through mucous membranes. These pathogens include, but are not limited to, hepatitis B, HBV, hepatitis C, HCV, and human immunodeficiency virus, HIV. Treatment and preventive measures after being stabbed by a sharp object that may contain hepatitis B, hepatitis C, and HIV virus via mucosa. Step 1. Clean the wound. Regardless of whether the source of blood/body fluids has been determined to be at risk of transmission, after contact with blood/body fluids, the wound should be washed thoroughly with soap and water immediately. There is no need to use antibacterial agents, because there is no evidence to prove their effectiveness. Do not suck on the wound. In case of mucosal contact, if blood/body fluid splashes on the conjunctiva, rinse the contact area with plenty of clean boiling water as soon as possible. Step 2. Go to the hospital immediately, seek medical advice as soon as possible, and then report to the company. To properly treat the wound medically, and take post-contact treatment measures, do a blood test. How can we reduce or eliminate the hazards of occupational exposure to bloodborne pathogen? Take standard precautions to protect yourself. Wash your hands frequently. Wear personal protective equipment, gloves, masks, cover open wound on the skin, use bleach to clean areas with blood or body fluids, and get vaccinated to prevent hepatitis B. Thank you.